So I invite Dr. Prakash Marathe, who will be speaking on what if your children are non-medicos or non-ophthalmologists.
Good morning, everyone. I must thank Dr. Rajan Anand for putting faith in me and including me in his IC. And this is really very much innovative IC, out of the box IC. There are so many ICs in this All India Ophthalmological Society conference, and most of them are related to ophthalmology, surgical, clinical, and whatnot. And you are going to learn each and everything in various halls. But this is something else. And for this particular topic, Club 60, the road forward, how to move forward in your generation next. What idea he had in his mind, that is, after the age of 60, you are at that particular point of time about your next generation, about your practice, about your settlement, and what are the plans of your family in future. And in that relation, he has allotted this topic to me. That is about when you are around 60 or more than 60, your next generation may be in different scenario. And that scenario was maybe ophthalmologist, maybe non-ophthalmologist, maybe doctor, maybe non-doctor. And most of the aspects are covered by my previous speakers. So the topic allotted to me was if your next generation is non-doctor or non-ophthalmologist. So I think he chose me in that particular perspective. And luckily that topic was suiting me. And I'm very sorry to say that little bit personal information may be given here because the topic is like that. So very sorry for that. Because actually personal information to be shared is not, it is like self-promotion. So one may not like it. But
so we are past the age of self-promotion now.
Because the topic allotted is like that. It is not moving forward. Slide. Slides. It is not moving forward. Well, these are the two important points when you consider your next generation. So talented with potential. And if you are unfortunate, by God's this thing, if your next generation may not be having that particular potential. In first case, you have got the option to nurture your next generation, to help them, to facilitate them to take the decision. And in other thing, you don't have many more options. And these options may not be ophthalmology, non-doctor, and maybe some paramedical courses, maybe some pharmacist, maybe some general job, general profession. That's where you can guide your next generation, if the potential is little less. But if the potential is little bit good and talented one, you have got so many choices. Maybe medicine, maybe non-medicine. And if medicine, there are various options. Okay, after this slide, we will move forward. Like first is linking towards medical profession. Okay, most of the ophthalmologists, I'll say most of the doctors, they feel that their generation next may be doctor. Most of the ophthalmologists, they feel that their next generation should be ophthalmologist. Then second one is, next generation may be ophthalmology or non-ophthalmology. This is very important challenge and what I have faced this. And how I have tackled, I'll just let you know. Next is linking towards medical profession. And that particular linking is may not be doctor, but maybe paramedical, maybe optometrist, some optical shop, something of that sort. Next is no linking towards medical profession, but the generation next is talented. There are various options, lucrative options nowadays. The people don't want to come to medicine. And what they say, IT is well-paid job, engineering, law, architect, CA, even IAS they are thinking. So this is the general map of your generation next. And these are various options. Now, in this era of corporate hospitals, and if you are the solo practitioner, maybe it is very, very, very difficult to survive. Small size hospitals may not be able to survive in future. Take it from maybe 5 to 10 years down the line. Because corporate hospitals are taking forward everything. Like big institutes, big eye institutes are there. Consider yourself, you are having your own eye institute. Do you have your own corporate hospital? In that scenario, Your son or your daughter-in-law or son-in-law may or may not fit in that particular situation. So assess yourself. I know various big ophthalmologists, their next generation is administrator. They are doctors, but they are not working. They are just handling the institute. So get it run by others. If the potential is not there, or if the potential is there, you can have many more institutes and you can run those hospitals by others. So career in medical, but non-ophthalmology. Here my role comes. Now again, little bit personal. I have got only one son. From the very start, he was talented. He was above the standard and meritorious. So up to standard 10, he had various options in his mind, whether to go to medicine or maybe non-medicine. One fine day he was saying that, yes, I'll become the doctor. In between, he was saying at 12, in the 10th, he was in the merit list of that particular SSC board. In 12th, there was a choice that to take medicine, to take biology, maths or both. I had the history in 12th, I had both of them. And I was getting admission to engineering as well as medical. And after engineering admission, I chose to medical. The same way, the advice I gave to him, don't leave both options. You have both these options. Because till you pass 12, you may be having some choice in your mind. Okay, little bit time, can I take? Yeah. So the choice he had of both those streams. So even IIT stream he was thinking, even medicine stream he was thinking. But then he said, I want to become a doctor. But he got admission. He was the topper in that particular Pune division. He was getting all admissions, all engineering colleges and all medical colleges across the country and any branch, whatever he wanted. Now he said, I want to become a doctor, but I don't want to become ophthalmology at the time of clearing his MBBS. And that time also he was the topper. And at that time also getting PG in all branches, like anything. Then he said to me, Dad, I can become ophthalmologist. Now you can tell to your colleagues that I can become ophthalmologist, not that I cannot become, but I want to take general surgery because I want to become cardiac surgeon. Because to become the cardiac surgeon, you have to go as general surgeon. But people will tell you that why he didn't get ophthalmology, so he has got general surgery. Not that. So after general surgery, he became cardiac surgeon. And there also he got the gold medal. Now after cardiac surgery, he said that though I am the cardiac surgeon, I want to become pediatric cardiac surgeon. Again, the narrow branch, less lucrative, more difficult, more challengeable. Then he became pediatric cardiac surgeon. That time I thought probably I'll get the daughter-in-law who is ophthalmologist. We searched the daughter-in-law at various places, but apart, we didn't get. Now, he got married with MD pediatric, totally different branch. But then after cardiac surgery, he became pediatric cardiac surgeon. And luckily, after marriage, that time she was MD pediatric, she got fellowship in pediatric cardiology. And then she became pediatric cardiologist. And both of them came in the same field. He got chance after becoming the cardiologist. He went abroad, Australia. And almost 5 to 6 years he's there in Australia. In between, for 1 year, he was at Boston, that is Harvard Medical School. And now he's in Brisbane doing pediatric cardiac surgery. But then I am happy. I've got only one son. Now I'm at this stage that I can go to Australia, I can live in India. But I have devoted my time to IMA, ophthalmological societies, and doing my solo practice. And I'm happy because this is my passion, to devote time for society work, social work. And that way I'm keeping myself happy. Most of my family members are there in Australia. After this particular conference also, I'm going to visit Australia for 10 days because I cannot leave my practice here. So that is the balancing of life, what I have started. Maybe a little personal, but sorry. He was research oriented. Why he didn't continue in India? Because his publications and international repute is much more. And he got that platform there in America as well as Australia. So I think with this,
Dr. Marathe, you were the last speaker. We have a lot of time and there are some seniors and youngsters here. We can have a lot of discussions. I just wanted one question from you. So now what are you going to do about your practice?
Actually, I am currently completing 63 years of age in the next month. But I thought maybe I have got 10 years in my hand. But for these 10 years, I'll be continuing my solo practice. And after that, because my generation next is not in ophthalmology, I'll try to complete it and continue it for next 10 years. And that I'll stop. And then I'll be the family person, maybe here or there. I don't know.
Age is just a number for you.
Yeah,
You are an inspiration, sir. You are so full of energy.
Thank you, thank you, thank you.
Thank you, Dr.